declines in donor resources, which have for a long time strengthened and sustained health services in the continent. Our journey began in May, and it continues today. And then in May, we had an opening dialogue, and the subsequent monthly events took some sort of deep dives into more health for money, focusing more on efficiency. And then we had another event last month, which focused on more money for the health or resource mobilization. And today, we bring all these threads together to focus on governance and leadership, a topic which is central to everything that we have discussed thus far. So to our attendees today, please feel free to use the chat to introduce yourself, to post questions. And for those who prefer French language, there is live translation which is provided. If you check the chat, there should be information on how to navigate to the French translation. Now, going to our roundtable today, I do want to introduce our esteemed moderators who will be in charge of the cockpit today. So it is my pleasure to introduce Professor 𝗧𝗂𝗂 𝗧𝗂𝗶𝗧, who is the Dean of the University of Ghana School of Public Health and has extensive experience implementing health programs in several African countries. He is also the scientific chair of the Interest Conference, which is popular within our African continent, and is also a research fellow at the Amsterdam Institute of Global Health. So for additional details on Professor 𝗧𝗂𝗶𝗧's profile, please check the chat. That information is being posted in the chat. Co-moderating today's event is Dr. Robert 𝗥𝗂𝗂𝗧. Dr. 𝗥𝗂𝗂𝗧 is the CEO of the Impact Delivery Group. And at IDG, Dr. 𝗥𝗂𝗂𝗧 leads efforts to transform traditional aid into sustainable trade-based solutions that foster economic independence for individuals and communities. IDG delivers innovative strategies in corporate protection, access to capital, and organizational excellence. Additional details on the profile of Dr. 𝗥𝗂𝗂𝗧 are also provided in the chat. Please check there if you want more information about him. At this juncture, I want to hand over the proceedings to our moderators. Professor 𝗧𝗂𝗶𝗧 and Dr. 𝗥𝗂𝗂𝗧, over to you, gentlemen.
All right. Thank you very much, Mula, for the introductions. And I'm really happy to co-moderate this important session with Dr. 𝗥𝗂𝗂𝗧, my friend and colleague. Before we proceed, I really want to acknowledge our sponsors, that's Africa CDC, Africa Health Catalyst Forum, Cutting Edge Public Health Solutions, AP Solutions, African Hub for Innovation and Development, PNP Ahead, Policy Innovation Center, and 𝗔𝗯𝗍𝗍𝗀𝗧. We really thank them for all the support that they have actually given this initiative. To proceed, I really want to make a few preliminary remarks in terms of Africa's road to self-reliant healthcare. We've had a number of sessions, like has been said. The first one focused on the world of opportunities, the case of reimagining African health, and then the need to move away from donor dependency by strengthening the governance mechanisms, mobilizing cross-sector collaboration, integration, as well as incorporation of community-driven approaches. We also looked at how we can achieve efficiency and impact in the round two. And then, of course, in this, we are able to outline how governance, leadership, and efficiency are strategic enablers. And the last session that we had, we looked at mobilizing sustainable funding and the importance of innovative financing with a governance framework that ensures that we guarantee efficiency, equity, and accountability for our populations. It is obvious from all these roundtable sessions that governance and leadership is the heartbeat of building a self-reliant healthcare system in Africa. Without these strong governance structures and visionary leadership, even the best technical interventions will struggle to achieve sustainable impact. 4 weeks ago, Ghana had the honor of hosting the African Health Sovereignty Conference, which brought together leaders from across the continent and beyond to deliberate on reimagining global health architecture. The outcomes were significant. Among them was the launch of the SUSTAIN initiative to promote country-led, investment-driven health systems, drawing on the domestic resources and the engagement of the private sector. I mean, this week, the Lusaka agenda, which started on Monday, calls on strategic shifts for global health initiatives to effectively and efficiently complement domestic financing to maximize health impact in support of country-led priorities. So, colleagues, this session basically, it's important as it advances our hope and wish to ensure that we strengthen our governance and leadership architecture towards universal health coverage. With this, I would allow my colleague, Dr. Robert Tigil, to come in and introduce our panelists. Thank you.
Okay, thank you so much, Professor 𝗂𝗂𝗂. Much appreciated for opening this meeting this morning, this afternoon, wherever you are. Good evening. We are continuing the Africa's roadmap to self-reliant healthcare today. Like you all know, today is Roundtable 4. Like Professor 𝗂𝗂𝗂 said, we'll be looking at closing reflections, and we'll focus on governance, leadership, and the path ahead. We've gathered 3 esteemed panelists for our conversation today, well-experienced panelists for that matter, and I promise you, you are going to learn a lot from them. The first I will introduce in no particular order is Dr. Beatrice Lydia Batanje. Dr. Beatrice Lydia Batanje is the CEO of Malawi's National AIDS Commission. She's a medical doctor with a PhD in global health and a master's in epidemiology. She has led major donor-funded health programs and authored over 20 peer-reviewed publications, advancing public health in Malawi and the continent at large. You can look at the screen and view more details about Dr. Beatrice. Next, I will introduce Dr. Raji Tajuddin. Dr. Raji Tajuddin is Acting Deputy Director General for Africa CDC. He has postgraduate training in pediatrics and public health. He's a fellow of both West African College of Physicians and the Chatham House. He is a leading voice in health policy and emergency response across the continent. See more details on the screen. Finally, I wish to introduce Dr. Magda Robalo. Dr. Magda Robalo is president of the Institute of Global Health and Development and former Minister of Health in Guinea-Bissau. With 30 years in public health and senior roles at World Health Organization, she is a champion for equity-driven systems reform and global health diplomacy. Those are the 3 key panelists that will be having a conversation on this key topic that we've mentioned. Like you saw, they have vast experience in governance and leadership, and together with all of us, we'll be able to trace the path ahead. Okay, let me start with a few questions to Dr. Beatrice. Dr. Beatrice, how has adaptive leadership practices helped Africa health systems navigate through shocks?
Thank you very much. Indeed, the year 2025 has seen Africa and the rest of the developing world with funding cliffs. This we know was triggered by the aid freeze from the US government, which included the PEPFAR's $4.8 billion reduction in annual budget, 60% withheld, and this affected HIV and AIDS greatly, and that led to 74,000 excess HIV deaths. projected by the year 2030 if the trajectory remains the same in the funding landscape. And these disruptions were followed by similar reductions from European donors. And we know that the impact has not only been for HIV, it has also affected malaria, neglected tropical diseases, maternal and child health, and 𝗟𝗟 in general. So adaptive leadership has mitigated these shocks through several practices, and I'll mention a few. Firstly, mobilization of domestic resources and prioritization of self-reliance. Leaders across Africa have demonstrated agility by reallocating national budgets to bridge gaps. For instance, in Nigeria, the legislature approved an additional $200 million for health in 2025 to focus on vaccines and epidemic treatments, offsetting the 𝗵𝗲𝗱𝗃 losses and preventing rises in HIV infections and deaths. In Ghana, another example, the president directed the finance minister to fill the USAID funding voids to sustain essential services urgently. And for Malawi, where I come from specifically, the government of Malawi also demonstrated significant commitment to the not only HIV and AIDS, but I'll give an example of the mitigation in HIV and AIDS space. January, February was the time when the budgets were already, or plans for the next financial fiscal year were already in place, but the government was able to navigate and reallocate some funding in order to mitigate the voids and the losses that were there. So there were resources that were redirected to support the 𝗟𝗟 financing, the human resources for health. There has been a plan to hire more than 4,000 health workers, and currently around 2,000 have already been recruited. And capacity building, because a lot of services were being offered by partner and specifically US government-supported staff. Over 4,000 were affected. And the issue was, even if we deploy government or public servants whose capacity or whose skills are not up to date, there's need for increasing capacity building. So resources were allocated. In general, there was almost $11 million that were increased in the budget for the Ministry of Health to support the voids that were there. So in short, adaptive leadership uses evidence-based data for decision-making, especially for efficient allocation of resources, as noted in these countries that have singled out, as well as noted in the Africa CDC's new public health order. Secondly, fostering of partnerships and regional integration. So adaptive practices involve breaking silos by leveraging regional bodies. So we do have our regional bodies, the Africa CDC, the African Union, the SADC, the 𝗥𝗲 health community, and the rest. And also, like you mentioned, moderator, the Lusaka agenda, which reforms global health financing for predictability and reducing dependency. These efforts include sustainable mechanisms, food procurement, disease surveillance, and generally integrated health for universal health coverage. And not forgetting the public-private partnerships, such as the African Medicine Agency for harmonized legislation that boosts local pharmaceutical production and cut reliance on aid-funded imports. We also see that in Kenya, adaptive leadership post-𝗵𝗲𝗃 cuts has involved community health workers in oversight, enhancing trust and efficiency. So there are all these best practices across Africa in different countries that, if leveraged and scaled up across the whole Africa, these shocks in financing, external financing for health, can be mitigated, and Africa can be self-reliant. I think finally, I'll just talk quickly on inclusive citizen-led accountability. So we've seen that with the shocks that have come, the adaptive leaders have amplified the inclusion of civil society voices, participatory budgeting, dialogues, and I'll give examples later of some of the best practices in how civil society has supported citizen-led accountability. Thank you.
Thank you. Dr. Beatrice, I'll get back to you, but what you said is very clear. Adaptive leadership, you provided examples in Ghana, Kenya, Malawi, Nigeria. We'll get into those details later on. That's so good. Let me hop over to Dr. Rabalo now. Dr. Rabalo, what governance models allows adaptive leadership practices to strive? Can you speak to that?
Thank you very much for that question. Building on what Beatrice has just mentioned, indeed, we have seen a couple of countries making pronouncements about injecting additional resources into the health system to allegedly fill the gaps or at least mitigate the impact of the reduction or freeze of PEPFAR and USAID funding. But I want to caution about that optimism, because I think the larger number of African countries have not been able to demonstrate that adaptive leadership. And even those who did, it did not happen in a comprehensive, inclusive, and targeted way so that we could see the impact they would bring in mitigating the freeze in the US funding. The governance mechanism that we need in order to adequately address donor dependency. And I want also to make a shortcut here to talk about donor dependency, not only in terms of financial resources, but also technical assistance. We should not forget that the financial resources that come to our countries from external donors also bring in attached a massive number of technical support. So we have a double crisis to mitigate here. Governance mechanisms that are needed are not yet in place. Despite the proclamation of the new public health order a couple of years ago by Africa CDC, which is a very much needed move forward for the continent. When 3 years ago, Africa CDC, under the leadership of Dr. John Kengasong, announced that Africa needed a new public health order in order to reduce dependency, start local manufacturing, and be able to produce the medicines, vaccines, diagnostics, and technologies it uses. We needed a new global public health order, which depends very much on governance. How are we going to reform the governance system at global, regional, and national level? The governance system and mechanisms that we need have to be built on inclusiveness, on multi-partisanship, and they have to they have to last beyond electoral cycles, so that governments can align behind a vision where health is prioritized irrespective of the party that wins elections, and governments need to work as one in a coordinated manner so that health continues to be funded and prioritized. We are not yet there. I don't buy into the idea of saying that because we have been through so many outbreaks, from Ebola to COVID to now Mpox, we have resilient health systems. We don't. We shouldn't normalize the fact that so many people die when outbreaks arise in our countries. And we believe that we have resilient health systems. We don't. If
now,
we had...
talking about resilient systems, Dr. Rovallo, how can we institutionalize leadership beyond election cycles?
That's what I'm saying. We need to move our democracies beyond, looking beyond elections and looking how our governments function. We need to build multi-partisanism within our government so that after the elections, we focus on what services do we provide to the people, rather than looking into how my party will look to the people in order to win votes next time. And very often, infrastructure and other areas are prioritized, and health is the last child of our governments. We need to break that cycle. We need inclusive and social participatory governance. in order for health to continue to be prioritized across governments. We have not yet established mature governance systems where accountability is built into the system, where parliaments demand accountability and the people are represented faithfully by the parliament and demand accountability from our governments. It looks like I'm talking politics rather than talking health, but health governance depends very much on how we play politics in our countries. So I want to insist on the fact that we need to move into a more mature ways of governing whereby the multiple political parties in our countries sit down and agree on a vision that, irrespective of who wins elections, we prioritize vulnerable people. We prioritize pro-poor, pro-equity governance so that health features prominently in our electoral manifestos, and then they are actually implemented. I want to say that we are talking about revising, reforming the global health governance architecture, and we need to build into that also the reform of the national health architecture. The two goes together, and the regional health architecture in between also needs to be reformed. The EU and its regional economic communities need to sit together to design a new mechanism for making sure that there is accountability, there is pro-poor, pro-equity policies, before we can talk about local manufacturing, before we can talk about being independent from external resources. Only if we start from the beginning, if we start from where we should, which is governance, we will not be able to have local manufacturing and producing medicines, diagnostics, and tools that our people need. We need to see first how do we govern our countries, particularly when it comes to prioritizing health. I will stop here for now. Thank you.
Excellent. Thank you so much, Dr. Oballo. Now I head over to Dr. Tajuddin. Dr. Tajuddin, how can Africa health diplomacy amplify equity, shape good governance, and advance self-reliant health systems?
All right, thank you, Robert, for that question. Let me start by acknowledging the other panelists. Let me also especially acknowledge Dr. Magda Oballo, who has always been there for Africa CDC right from day one. And let me also thank the organizers of this important series. I mean, we've worked hand in hand to make sure that we get it right. And this is the last, the fourth of a four series. So, distinguished colleagues, ladies and gentlemen, the question that I've been asked to reflect on is how do we use health diplomacy to advance equity, to advance good governance and self-reliant health system in our member states? So the Africa CDC, as we all know, is a specialized technical agency that sits within an intergovernmental political organization, the African Union. So that in itself, put us in a unique position, to be able to leverage diplomacy, to advance equity, governance, and self-reliance. Colleagues, having said that, we know today, as we've heard from our previous speakers, that our countries, our member states rather, are going through a lot as far as health financing is concerned. And as a specialized technical agency, set up by our head of state and government to coordinate, and to support our member states, during a period, like this, where health financing is really, a major issue on the continent. we have seen gradual decline, up to 70%, between 2021 and now in terms of development assistance coming through the ODAs from developing countries. We have also seen rising debt servicing obligation, rising from 21 billion to 81 billion, in our member state, talking of the 55 member state, 1.5 billion people. And to worsen this thing, we have also seen that when it comes to domestic resources, mobilization or allocation to health, we've seen that most of our member states are nowhere near the Abuja target of 15%, that clearly, stated that 15% of the national budget should go into health. In fact, only 3 member states have consistently, passed that 15% target for more than 2 decades. Most of our member states over around 5 to 7%. So really, we have a big issue, before us. And tied to this, we continue to witness repeated, recurrent, emerging and re-emerging infectious disease outbreak. We've seen more than 40% increase in a space of 3 years. Today, we have mpox, we have cholera, we have Ebola, we have all sorts of emerging and re-emerging infectious disease and outbreak. And on top of this, we have a very weak health system. So the big question now is, what are we doing as Africa CDC to ensure equity, good governance, and self-reliant? Given what we've seen with the ODA, we recently launched an initiative called the Africa's Health Financing in a New Era. So this initiative is underpinned by 3 critical pillars and a 4th pillar that is cross-cutting. And what are these 3 pillars? Number 1 is around domestic financing. We are working with our member states to reduce dependence on external aid and also push them towards reaching that Abuja target of 15% of the national budget go into health. Number 2 is around innovative financing mechanism to address some of the health financing gap. This include building their capacity around solidarity levies like taxes on airline tickets, taxes on eligible imports on alcohol, tobacco, and so on and so forth. And we are also exploring how do we work with the diaspora, the so-called 6th region of the African Union, to mobilize resources for health. How do we work around diaspora bond and remittances, to increase health financing? And last but not the least is around blended financing. How do we work with the private, the philanthropic, to make sure that we leverage that partnership to bring on board, capital that can be invested in health initiatives. So a lot of work is going on in this particular space. But much more importantly, we are also working with our member states to ensure that we have good governance, so that we have more services for the little money we have, and also ensure that the little money is able to offer and deliver, a lot of services for our member states. And tied to governance is the Lusaka agenda. So we're also looking at how do we better shape the global health initiatives, to ensure that whatever that is coming in there clearly align with our national priorities. Clearly
aligning with national priorities. Dr. Tajudeen, that's a good pause. Aligning with national strategies. Professor 𝗂𝗂 will pick it up from here and engage with you further.
So, all right. So, okay. So just to draw a conclusion on this is the fact that we need to ensure that we shape the global health initiative, to our advantage. The era whereby those global health initiatives will come with imported priorities is long gone. And Africa CDC is working with member states to ensure proper alignment in the spirit of one country, one plan, one budget, one report. And over to you, Prof.
All right. Since we still have you on, I want to ask you from where you sit and with the experience that you gathered at the continental level, which accountability mechanisms have most improved health system performance?
All right. No, thank you. Prof. So, when it comes to health financing or health in general, is one area that is so critical for the African Union. And it's also one of the reasons why we're set up as Africa CDC. So a couple of, initiatives as far as accountability is a concern. So let me start with the Lusaka agenda itself. When this initiative came on board, what we did as Africa CDC is first to set up a secretariat, that would define an accountability mechanism. And tied to that accountability mechanism is also scorecard, that will monitor compliance, with that, the provisions of the Lusaka agenda, compliance on the side of the global health initiatives, and also compliance on the side of our member states. And this scorecard, we actually the table before our political leadership, so that collectively they see who is doing well and who is not doing so well, and by so doing, we'll provide the needed support for those countries that need all sort of support. Another area in terms of a pandemic prevention, preparedness, and response is to work with our other institutions, other partners, talking of WHO, especially around health security, the international health regulations. Through the JEE, we have been able to support our member states in terms of National Action Plan for Health Security, which we periodically monitor who has developed that, who is developing and who is doing what. And for those who are lagging behind, how do we, ensure, that they are able to achieve the provisions of the international health regulation. And this has also worked very well for a lot of our member states in area of preparedness. Number 3 is around the health financing itself. Today, Africa CDC is launching the public financing, management, to support our member states. So it's around capacity building on how do we really support the public financing management system in our member states? How do we support them to develop a sort of health financing sort of plan that will key into the overarching development plan of our member states? And tied to that will also be like a scorecard, that will allow us to measure the different indicators and targets. And the most notable one is the 15% target. Another one is what is the per capita spending, on health. Does it align with that WHO, target of around $234 to $250, per capita? So these are all sort of scorecards, that has clearly aligned with both the health security and universal health coverage. And then beyond that as well, we're working with the United Nations Economic Commission for Africa to ensure that our member states are on track towards the 2030 agenda, talking of the goal 3, that is essentially around universal health coverage. Who is on track, who is not on track, and how do we better support those member states who are not, on track. So these are the various sort of accountability mechanisms, that actually worked, and working with our member states, we are able to build the necessary capacity, especially for those member states who are not on track, towards, achieving those different global health goals, that have been set through the different sort of decisions and declarations from our other state and government. Over to you, Prof.
Thank you very much, Dr. Tajuddin. So to switch gears to Dr. Beatrice Matande, given your experience, particularly with the civil society, what will you say is the role of civil society and the public in promoting innovation, transparency, and accountability?
Thank you very much, Prof. Indeed, citizen trust is foundational for sustainable development, including health. And therefore, Africa's health landscape, within Africa's health landscape, civil society organizations and the public are not mere observers, but active drivers of resilient and self-reliant systems. And there's a role that the civil society plays in accountability, apart from the other innovation and enhancing transparency. So I'll say a little bit more on this. On promoting innovation, the civil society and public do catalyze innovation by bridging gaps between policymakers, communities, and emerging technologies. So in resource-constrained settings, civil society advocate for community-driven solutions that address local needs, fostering inclusion and innovation. For instance, in Ethiopia, civil society engagement has promoted routine data use and evidence-based policymaking, integrating digital tools for health monitoring and to improve service delivery. And in Malawi specifically, I think today we do take pride in the fact that we have reached the 95 epidemic control goals for HIV, because the civil society and communities were at the center of the response. Right before the PEPFAR and the Global Fund came into being, civil society and communities were there. So specifically the promotion of innovation and other solutions, civil society cannot be left behind. By public participation, there's an amplification of voices, and we know that over 120 civil society organizations across Africa have united not only for HIV, but even for immunization advocacy, influencing policies and introducing technology-enabled tracking systems to enhance vaccine equity. In Burkina Faso and Senegal, civil society synergizes with education sectors to integrate innovations into policy, demonstrating how public input can turn grassroots ideas into scalable solutions. So this role is vital amid funding shocks, and civil society pilots, which are low cost, need to be scaled up across Africa. The second one is enhancing transparency. On this one, the civil society, and through the Africa Freedom of Information Center, this empowers civil societies to demand for fair practices, holding leaders accountable through access to information campaigns. In contexts like Liberia, where 53%, there is about 53% bribery in healthcare, as documented, and in Cameroon, about 30%, citizen-led oversight has exposed these inefficiencies. If it wasn't for them, maybe we wouldn't have known in the public arena. Pushing for open contracting and procurement to increase inclusivity and reduce graft. In Malawi specifically, civil society has played a vital role. The National Health Financing Strategy, which is government-led, its implementation is monitored by the civil society through Civil Society Accountability Forum. They have come up with an advocacy plan that will monitor the implementation of the national strategy that has been put in place. And the accountability mechanisms thrive through citizen-led oversight, as I said once again. And for HIV place specifically, community-led initiatives have been scaled up, not only for the National Health Financing Strategy, but across the HIV programming and across all sectors. These efforts ought to be applied using an integrated approach across all health issues and not just HIV. What we are enforcing now is that these indicators should be used because they have a monitoring tool. Within the community-led monitoring indicators, there is health financing indicators that are there. And this should cut across all indicators, all programs, and not just HIV. So in conclusion, I would say that civil society and the public are indispensable for fostering innovative, transparent, as well as accountable health systems. We need to amplify their voices, to monitor progress, and to advocate for equity through the civil society organizations that propel Africa towards self-resiliency. So regional and the national priorities should make sure that the civil society are at the center of all the policies. The national policies should not leave out the citizen-led mechanisms to ensure that the system answers to the people and not just to the leaders on top. Thank you.
Thank you very much, Dr. Matanje. That was well delivered. I think we've talked about active leadership practices. We've looked at the governance models, how to institutionalize leadership beyond election cycles, and then also looked at how African health diplomacy can amplify equity, shape good governance, and then advance self-reliant healthcare in Africa. We've looked at some accountability mechanisms, and then also the role of civil society. So I would actually invite Dr. 𝗏𝗏𝗀 to give us the closing remarks, her closing remarks. I mean, Dr. 𝗏𝗏𝗀, followed by Dr. Tagjuddin, and then finally, Dr. Matanje.
Thank you. I wanted to bring here a suggestion on how we could move forward and build resilient health systems beyond electoral cycles. What our countries need, in my humble view, is to start developing 15, 20, 30 years development plans. We know our countries are not going to develop in the next 5 years. Our health sector, our health systems are not going to become strong in the next 5 years. We have been short-sighted by coming up with 5 years plans, strategic plans for our health sector, because they respond to the donor cycles, but also to the election cycle. We need to bring a nation to build a long-term development plan that will look into how is our economy going to grow in order to feed the investments that we need for the health sector. How are we going in our education sector, train the doctors, the nurses, the midwives that we need in the long term? How our external relations, our foreign policy is going to develop? Who are going to be elected as our partners? How are we going to work with them in order to, in a 20 to 30 years period, help us develop our countries? How are we going to develop our research agenda, not just for health, but for different areas, looking to the climate, looking to how going green is going to be shaped in Guinea-Bissau? How are we going to financially mobilize the resources from the diaspora and invest in social housing for our people, invest in sanitation, in water, so that we can, in an harmonious way, tackle both the preventive and the treatment needs that our health system demand. So this is not a business of 5 years, and it is time for our government to bring civil society, communities, private sector, all the different parties together, adopt a long-term vision for a country. Irrespective of who wins the election, we know that this is what we are going to do to get our country out of the underdevelopment that we are. Of course, every 5 years, we need to review the indicators and then correct what needs to be changed and adapted. But if we continue with short-sighted ways of looking into our development, we will not build sustainable systems. It is not just about health. It is about social determinants. It's about housing. It's about potable water. It's about sanitation. It's about investing in research. That's the only way we can develop. And governance has to be the central mechanism where all this is built. If we don't have good governance and accountability, inclusive governance, we will not be able to achieve resilient health systems that we have been longing for forever. I will stop here, and I hope this message will resonate with those who have been helping our countries to plan and reimagine health systems. We cannot reimagine in a short-sighted way. Thank you.
Thank you very much, Dr. Tagjuddin.
Can you hear me now?
Yes, we can.
All right, no, thank you. So my concluding remark will be that one, the need for equitable, self-reliance, and appropriately governed health system is no longer a choice. It has become an imperative. Number two, we need capacity building. we need capacity building. We need capacity building in terms of leadership, public health leadership, because today we know that member states with the right leadership are able to coordinate when it comes to any response to any threat within the national system. Talking of Ebola, cholera, mpox, so we need to train more public health leaders. And we also need capacity building around health diplomacy. There's so much negotiation going on in the global health space today, that as a continent of 1.5 billion, 55 member states, we are not doing so well. So we need that skill. And in this regard, Africa CDC has launched a couple of initiatives, but Africa CDC cannot do it alone. So we need other partners to join forces with Africa CDC to build the necessary capacity around leadership, around health diplomacy, around public health, legal preparedness, and so on and so forth. Number 3, we need to also ensure that this development assistance for health that's reduced drastically without any notice. We need to support our member state, to be able to manage that gap, and in this regard, Africa CDC has launched the Africa Health Financing in a New Era. And we invite all of you to join us, to provide the necessary support around mobilizing resources domestically, around innovative financing, around blended financing that tend to bring the public, the private, the philanthropic, everybody together, to be able to make appropriate investment in that, health, system. Number 3 is the fact that we are few years away from Agenda 2030, talking of the Sustainable Development Goal. We need to put our heads together to support member states who are not doing so well, because that's the only way we can ensure equitable and self-reliant health system. Talking of mother and child health, talking of financial protection, talking of addressing uncommunicable diseases, talking of addressing infections and both emerging and re-emerging outbreaks on the continent. So we need to really build the necessary capacity. Number 4 is around putting in place local manufacturing capacity, and tied to this is a pool procurement mechanism that will ensure equitable, affordable access, to those essential health products and the medical and non-medical countermeasures, that will allow our member states, to be able to address or to be able to achieve the so-called universal health coverage on one side and also ensure health security on the other side. Number 5 for me is the fact that we need to work together, we need to coordinate, we need to collaborate, we need to communicate, and we need to ensure that we share information in a timely manner. And then last but not the least for me, we need to ensure that we carry our community along. We need to carry them along in every step of the way. And in this regard, Africa CDC has developed a very robust community health system, whereby we are working with all our member states to ensure that we build the necessary capacity, at that particular level. And for me to close is to say that governance is critical, because when national governance is effective, donor fund will be well aligned with and channeled through our national system. And by so doing, we're able to strengthen our institutions rather than working around our institution. And this is essentially what the Lusaka agenda is talking about. How do we ensure that we're able to get more for the little money, and also ensure that the little money is able to offer more in terms of health services? Thank you, and over to you.
Oh, thank you very much, Dr. Matanje.
Thank you, Prof. And to our dear ladies and gentlemen, esteemed colleagues, as we conclude this pivotal roundtable on governance and leadership in Africa's health transformation, I would like to end with profound optimism. We have delved into the examples of adaptive leadership. We have confronted the stark realities of funding cliffs, fragmented governance, and as highlighted by Prof. 𝗤𝗏, the short-sightedness that has been there for a long time. Yet in all these discussions, one truth emerges crystal clear. Africa's health destiny lies not in lamenting about the dependencies, but in boldly seizing our collective agency. We should remember we are not victims of our circumstances, but we are architects of our self-reliant future. So in looking ahead, I would like to recommend 3 priorities that would define our roadmap to universal health coverage and resilience across Africa. Firstly, institutionalizing domestic financing mechanisms. Just to emphasize what my colleagues have already talked about, we must transition from donor dependency to sustainable models. For example, by expanding the African Development Bank's health portfolios and also mandating national implementation of 15% of the budgets for health as per Abuja Declaration. Since it was put in place, very few countries do achieve this. Others, they are closer to it, and then they go back to 9%, 12%, and the like. Secondly, amplifying inclusive leadership and governance. This would also embed gender parity, aiming for adequate inclusion of women and the youth. We know that currently only 10% and 24% of women and youth respectively are involved in the decision-making across our continent. So the continental programs like the Africa CDC's Kofi Annan Fellowship, which has already trained over 80 leaders, should be scaled up to nurture more, 1,000 or more, to foster adaptive citizen-centered approaches that would integrate civil society for transparency and accountability and make sure that there's inclusion at all levels. Thirdly, and finally, I would call for harnessing digital innovation for equity. There's a need to invest in scaling up of tools like the digital public financing, financial management tools, and AI-driven surveillance. We know that surveillance is key to to monitor all these things that we're talking about. There's no way we're going to end the public health emergencies without sustainable surveillance systems. And AI is here to support and to help us.
All right, thank you very much.
Underserved communities.
Okay.
So to move beyond the dialogues that we've had today and we've had over the other 3 rounds to action, we do need to establish continental accountability mechanisms like a dashboard that would monitor and track progress on the priorities that have been set through these dialogues and priorities that have been set through all our other regional and health diplomacy and reshape the global norms toward true ownership. The path ahead is not paved with aid, but with audacity. Africa has talent, the resolve, and the ingenuity to build health systems that answer only to our people. Together, we can. Thank you.
Thank you very much. So I think we will now move into the question and answer segment. So I'm going to do this with my co-moderator, Dr. 𝗪𝗻 𝗔𝗂𝗂. We have some questions. I'll pick the first 2, and then my colleague Robert will continue. The first one has to do with the increasing risk of cross-border cholera outbreaks and the sharp decline in external aid. What practical support can Africa CDC and AU offer to help Chad, this is coming from the rapidly strengthen its local health workforce and WASH infrastructure? Then, so this will obviously go to Dr. Tajudeen. Then there is the good governance is frequently cited as the cornerstone of autonomous healthcare. What are the initial governance reforms nations must implement in order to have significant effects? So this probably I'll pass it on to Dr. 𝗪𝗻. Maybe we can get a response and then we can do the next round.
I'm not sure I understood the question, sorry. Professor 𝗪𝗻.
Okay, so it said, this one came from Johannes saying, good governance is frequently cited as the cornerstone of autonomous healthcare. What are the governance reforms nations must implement in order to have significant effects in terms of what we are discussing today? Yes.
Okay. Thank you. I think we need inclusive governance mechanisms where civil society as a role is listened to because they represent the voices of communities, and we need to also have gender embedded into our governance mechanisms. Women are the majority in our countries. They are unfortunately not visible in the statistics, both for the economy, but also in leadership in health. Inclusive governance is the way to go. I will stop here for the sake of time. If we bring the youth, women, and civil society communities represented in our mechanisms of governance and robust accountability systems, I think we will be on a path to good governance in our countries. Thank you.
Thank you very much. Dr. Tajudeen?
Thank you so much. So let me also keep it short. Yeah, so I mean, today we have around 24 member states, where cholera outbreak has been declared, and in terms of what exactly are we doing as Africa CDC, especially to ensure that the cholera does not keep jumping from one country to the other. So number one, just yesterday, colleagues, if you have been following the WHO Afro-Regional Committee meeting that is taking place in Lusaka, Africa CDC working with WHO, we launched a continental coordination cholera outbreak response plan. And that plan was launched by President 𝗖𝗹ន់𝗂𝗂𝗧, the president of Zambia. And this essentially is to ensure that there is proper coordination, there is proper, communication, cooperation, those forces, that I talked about earlier on. And what does this political leadership, what does it mean for the cholera response on the continent? Today, we know that cholera is not just a health issue, it's a developmental issue, and it's not something that can be addressed by the health sector alone. And where does the coordination lie? We know that it's difficult for health to coordinate that space alone, hence the need to take it to the highest political leadership, bringing on board the Ministry of Water Resources, the Ministries of Health, the Ministries of Finance to make adequate investment in that particular space, the ministry responsible for infrastructure, especially water, sanitation, and hygiene. And this is why Africa CDC elevated the cholera response to the political level. Secondly, what we're also doing is to provide technical assistance to all these member states by making sure that through our African Volunteer Health Corps, we are able to deploy epidemiologists to all these member states, to support the response. And we also deploy community health workers to be able to address this issue, this cholera issue in those remote areas. We're also working to ensure that each and every member state have access to the needed countermeasures, talking of the oral cholera vaccines, talking of the ORS, talking of the other, the water purifying agent that is, required, and we continue to ensure that there is timely sharing of information between member states through our cross-border surveillance, initiative as Africa CDC. So let me also keep it short and stop here. Over to you, Chair.
Thank you very much. Robert, I think you can take over with the next set of questions.
Okay.
A couple of comments too, so yeah.
Thank you so much, Prof. One of the questions reads like this: what is being done to improve the wages of public health professionals? I think this possibly goes to Dr. Tajudeen, but any other panelists can answer that as well.
Yeah, we have a former minister here, so I think it would be
yes. Okay. Former minister.
But let me start and hand over to Dr. Magda. So, the issue of wages, we know that is a very big issue, for the Africa CDC, what we're doing under the leadership of President Cyril Ramaphosa of South Africa, is to come up with health workforce sort of investment plan, that will allow our member state to see the need to put more resources into that particular space. So that is number one. Number two is also around coordination. Today we have the Ministry of Health, who is required to make use of the workers that have been trained. But there is no official communication channel between the Ministry of Health and Ministry of Education that is training these people. So there is no linkage between the producer and the user. Number 3 is the fact that even the agency that is responsible for setting salaries and wages, the Labor Productivity or Salaries and Wages Commission, depending on which country you are talking about, is also not brought on board to how do you salary which cadre of health worker. And number 3 is finance is also not aware of how many are being trained, how many is required, how many do I budget for in which fiscal year? So Africa CDC, working with our WHO colleagues, is trying to put all these bits and pieces together so that what is being trained speaks to what is needed, what is needed speaks to what is being budgeted for, and which cadre do we salary, at what level, So Africa CDC is working in that particular space. And of course, last but not the least, we continue to emphasize the importance of health workforce, that whether we like it or not, this is a priority group, and we need to continue to address, the issue of making sure that they're appropriately salaried, because that is one way to actually reduce some of this brain drain. Let me hand over to Dr. Magda.
This is why I say we need comprehensive development long-term plans. If we work on a disease standing alone, workforce standing alone will not be able to solve. Today we launch a cholera plan. Tomorrow we launch HIV or mpox plan. The day after tomorrow we are looking at workforce wages. WHO and Africa CDC cannot sort out the issue of wages. Ministers of Health cannot sort them out. I was there as Minister of Health every single day. I was facing strikes by health workers. I had to work with the Minister of Finance to put a pause, which I knew it was just a short-term pause because the fundamental problem was not solved. That's why I insist we need a comprehensive development plan, education, finance, water, sanitation, health, economy, to sit down and look at how do we move our countries from point A to point B and Z. Otherwise, we will continue with a short-sighted, fragmented way of looking into the issues, and that's not going to solve our problems. Thank you.
Thank you so much, Dr. Rouballo. Okay, next question. Next question, what is Africa CDC doing to realize sustainable emissions reduction?
Thank you, Mr. Moderator. We have the African Climate Summit coming up in 2 weeks' time. So the Africa CDC continue to work with the relevant AU institutions, that is in charge of this climate change. Ensuring that the health implication, of this climate crisis is adequately, addressed. And in that regard, we say that in terms of adaptation, in terms of mitigation, the health sector is able to contribute, its own quota to make sure that green energy is the way to go, as far as the health sector is concerned, and also working with the relevant sectors to make sure that we are, as much as possible, reduce the carbon footprint, and also to make sure that our political leadership, are also fully on top of this agenda and prioritize that. And in fact, in that regard, the president of Kenya, Ruto, has been, appointed as a champion, for all these climate-related issues. And last but not the least, this is a space that requires a lot of financing, a lot of funding. If you are saying alternative source of energy to reduce carbon emission, what funding should go into that? Who is going to produce or provide that funding? So in this regard, we are working closely with the Green Climate Fund, to avail our member states, with what it takes, to really finance this alternative source of energy. we are equally working with other, multilateral development banks, the MDBs and the DFIs, development finance institutions, to also allocate adequate resources, to the health sector to be able to contribute their own quota in terms of reduction of carbon emission. So thank you, and over to you, Chair. You are muted.
Thank you. So sorry. Thank you so much, Dr. Tajuddin. I'll ask one more question, then pass on to Professor 𝗂𝗂𝗧. What steps are you taking to strengthen the measurement of health status and its determinants in Africa? Dr. Beatrice, you want to take this?
Maybe while she's on, while Dr. Robert, there's also an interesting question I wanted to pass it on to Dr. B. This is coming from civil society. He's saying, I'm a patient with lived experience of sickle cell and founder of the community-based organization called Lending Hands. My question is, how do we ensure no one is left behind in building resilient health systems and ensuring community-led monitoring cut across every other disease area, not only HIV, TB, and malaria? Maybe now, Dr. Beatrice, you can weigh in.
Thank you very much for that question. Indeed, sustainability, for us to achieve sustainability, I would agree with Prof. Robaro, we cannot continue with disease-specific silos. So when we talk of sustainability and integration, we are talking of the community-led systems and the integrated systems that are not looking at what does the person have. So these are health systems. What we need to build and strengthen are the general broader health systems, or the pillars, the health system pillars. If it's service delivery, a person should be able to walk into a primary health facility, secondary health facility, whatever level, and be managed holistically. Whether they have HIV, they have diabetes, they have sickle cell, whatever they have, it must be holistic approach. And coming back to the HR question, how do we make sure this is possible? It's when our HRH, our Human Resources for Health, are able, they have the capacity to deliver all services and not recruiting only for HIV or recruiting only for sickle cell. So indeed, conditions like sickle cell and others have been kind of neglected before because maybe skills and capacity were not built enough within our health workers. So we will achieve sustainability or sustainable health systems if we go beyond the disease specifics, rather build the systems as they are in the broader way. Thank you.
Thank you very much. So at this point, I think we'll go into the open mic session and my colleague Robert will lead the engagement. This session basically is not to ask questions, but to share your insights in the topic that we have been discussing. Over to you, Robert.
Okay, thank you so much, Professor 𝗂𝗂𝗧. Now to everyone, I believe you will notice your mic is now opened. Or in case you don't see it open, you can send a note and the back-end support team will open your mic for you. So you indicate interest to speak. They will open the mic and you make contributions, not questions, but contributions. Thank you so much. Over to you. Help desk, you will help me identify interested persons and open their mic.
Oluwapelumi Aliu.
Good. Olua, please go ahead. Open your mic and speak.
Yeah, Olua is muted. Maybe we can go to Olumu Yuwa Olusanya.
Olusanya, go ahead.
Okay, good afternoon. Can you hear me?
Sure, go ahead. We can hear you.
So I'm Dr. Olumu Olusanya. I'm the managing partner and CEO of Insignia Health. We are a health consulting firm in Lagos, Nigeria. And I want to comment on what we're discussing today. So thank you for all the deliberations and insights that come from a lot of experienced experts. I just want to talk about working with a shared vision, using the frameworks for governance, which includes laws, standards, guidelines, and policies. I commend the work that CDC is doing in Africa to actually get all the member states to focus on having that shared vision and to make sure that financing is improved. But there's no way, like we agree that there's no way we can do that if you don't have these frameworks in place. So to agree to encourage all member states to set laws that will drive this in their countries. Talked about the 15% minimum in terms of expenditure that should be devoted to health, which is talking about prioritizing healthcare above every other thing. And even within prioritization of healthcare, we should prioritize access to healthcare, not infrastructural projects that do not necessarily give access to healthcare. So looking at it from the framework of having laws in place that are uniform as much as possible, standards and guidelines, then policies that are documented, are domesticated to the health ministries, and encouraging public and private sector to actually work together to make sure that health financing becomes a success across Africa. So I want to encourage that this should be done because those are the frameworks of governance. If you want to make sure that governance is achieved in any space, you must have that framework from top to bottom and make sure that it is implemented and adopted and prioritized. I think the most important thing is getting the political leaders to prioritize this thing, because we are very brilliant people in Africa. We read a lot. We are loaded, but getting our leaders to actually prioritize these things and execute them so that it's not just beyond speaking, is actually giving action to those things. Thank you very much.
Thank you so much, 𝗲𝗲𝗀. Okay, next. Who wants to go next? You can open your mic and start speaking.
Yeah, there is Nicole. Nicole, you can go. Nicole and 𝗪𝗪𝗓.
Okay, Nicole.
Yes, thank you very much. Thank you so much for the opportunity. I speak as maybe a community member, but I was technical advisor supporting health system strengthening in Cameroon. And one thing I think is important to not to forget is community engagement. Sometimes it's very hard. We can have very good ideas, but if we have a community, a dormant community, not ready to ask for things, they will never obtain. It is a real problem to be doing things for a community that doesn't understand what we are doing for them. So I think if there are activities to be carried out, one of the major activities should be to engage the community to know their right as health. They pay for their health, but they don't know what they should know. For example, what do we eat? We talk a lot about HIV, malaria, and tuberculosis, but what to eat for aging population to face menopause safely, to at least to know how to minimize this weight gain at this age. They don't know, and nothing is done for that. So I think something should be done for our population to own their health and not to be subject, not to be like in the key activities. Something should be clearly done for, like we go to television, we hear about malaria, TB, the global fund, and all this. They should hear about facing menopause, obesity, and all these type of diseases at all levels, maybe in schools, maybe in their job site. so that maybe health in all policy, where health is a topic well addressed at a higher level, not only by the Ministry of Health, where communities are being helped to know their right and to own their health. Thank you so much.
Thank you so much, Nicole, emphasizing the need for health education and health promotion in communities and also citizens' rights. Thanks for that contribution. I will go on to Bernarda.
Thank you very
Dr.
much.
Bernarda, over to you.
Thank you very much. I want to say a big congratulations to the organizers of this webinar. It has been quite insightful and educative for the past 4 months. My concern is the day after this webinar ends. What structure are we putting in place to ensure that we do not end it just as a talk show? How do we keep engaging ourselves after this? Today is the 4th round and is the last round. Are there programs? What are the next steps to ensure that this engagement and this conversation continues? Because it is important that we keep talking and engaging so that we can know where we are and what we have done so far. And then 2, I want to crave the indulgence that our civil society must pick up the responsibility to demand accountability from organizers to ensure that this forum doesn't just end today and we continue to have robust engagement on this topic, because we can't finish them all today. It's important to plan for the day after now. Thank you very much.
Thank you so much, Dr. Bernarda, emphasizing the need for continuous engagement and to demand accountability from leaders. Thanks. Abiodun, over to you.
So thank you very much. Good afternoon, everyone. Good morning, whatever you're at. Unfortunately, I missed the first 3 rounds of the webinar, and but of course, my question in the fourth session is great. And for me, I just also want to echo the fact that if we're talking about 50% of that declaration, there is no way we can also dissociate health from politics. So the way we're also able to present health as an investment case to the folks who are in charge of the resources was pretty much important if you're talking about domestic finance, domestic resourcing, and with the current uncertainty in the external funding landscape, I think there's no better time than now to make sure that we present health in a way that the politicians, the way the people who control the resources understand what we are trying to talk to them about. Maybe a little bit of technical jargons and more of the political languages in a way that they can also relate. I also agree with the fact that I think for us in Africa, our development plan needs to go beyond just 5 years. There is absolutely no way we can achieve anything that is substantive in 5 years. So once we have a long-term plan, it's pretty much important that we also have a short-term plan that can actually use to track our implementation, and if you're actually on the road to achieving the overall objective. But having a long-term plan is really, really essential. So thank you to the organizers, and it's wonderful to be here.
Thank you so much. Biodun emphasized the need for long-term plans. He recognizes that short-term plans are also important for tracking purposes, but that we must have long-term plans in place, just like Dr. Obalo mentioned earlier on. Any other contribution? We're still in the open mic session. More contributions, please. Professor 𝗧𝗂𝗂, anything else?
I think the questions have been answered, so probably we can move on to the next. If there are no, maybe we can give 30 seconds for one last question. Dr. Beatrice Batanji, I think you want to make a comment in the session, yeah?
Yes, so I know it's open mic for the participants, but I wanted to comment on the participant or speaker that talked about the need to, let's say, integrate. So while people hear about malaria, TB, and the HIV, but they don't hear much about obesity and the others, I think the core, really my core to all of us is let's think, let's breathe, let's talk integration at all levels. So there could be integrated global fund for the 3 conditions, but integration at service delivery level, integration at the programmatic and structure levels for not only HIV and NCDs, but basically integrating the health systems. So mainstreaming the things that have lagged behind. For example, NCDs, we don't talk much about NCDs. I'll still mirror on how HIV became a national, global, regional, at every level, everybody was talking HIV. Whether you are in agriculture or you are in finance or you are in whatever, you were talking HIV. We could still do the same, talk NCDs, talk obesity, talk the other issues, malnutrition and the like at every level. So national priorities should go on integration. How do we integrate? And breaking the silos should not just be on paper. We should all be willing to open up and talk with the next department, because ministries are organized in departments. If one department does not talk with the other, vertical, and the implementation will remain verticalized as well. Thank you.
Thank you so much, Dr. Beatrice. Okay, over the past couple of minutes, more than an hour, close to 2 hours now, we've been talking about Africa's roadmap to self-reliant healthcare. Today has been the closing reflections. We looked at governance, we looked at leadership, and we also had conversations around the path ahead. Some of the key thrusts of today's conversations were citizen trust. I think conversations pointed out the need for citizen trust, the need for community-driven solutions, because we also the centrality of the community and emphasize that we can't achieve anything without having the community in the center. We talked about the need for long-term plans, indicating short-term plans are good for tracking purposes, but we need to be visionary in nature. We need to have long-term plans like 15 to 20 years so that continuity will be ensured. We also talked about private sector engagement, private sector participation in sustainable development. We zoomed into the need for local manufacturing of health products so that little things like needles and cotton wool and so on would not have to be imported. That at least our local manufacturers should brace up and start manufacturing some of these things, including vaccines and other medicines. We also talked about our leaders upholding the 15% commitment for health financing. We indicated that today only between 5 and 7% is being met, meaning we are just possibly not even up to 50%, very close to 50% of the commitment value, and that there's need to take it up to 15% as we promised, if possible, even exceed the 15%. We talked about the need for use of information for this decision making, particularly talking about digital solutions for health, that we need to digitize our health system so that it improves accuracy, eases the need for getting information as timely as possible. We talked about continental accountability mechanisms. Citizens should hold leaders accountable. There should be an accountability framework in place, and this should be followed. We also talked about the need for South-South technical assistance. There will still be need for North-South technical assistance in highly specialized areas, but there was much emphasis on South-South technical assistance so that we leverage all the talents that we have around us. There was also a conversation around cross-border coordination, particularly when it comes to disease surveillance and global health security in general. Local intersectoral coordination and communication was also emphasized. There was a mention that ministries of health are structured into departments and units, but that we need to be having conversations. Within the ministry, people should be having conversations And even between the Ministry of Health and other ministries and agencies, there should be conversation as well. I particularly heard the need for conversation between Ministry of Education, Ministry of Finance, Ministry of Health, Ministry of Works and Housing, and so on. So basically, there should be a mainstream of intersectoral communication and coordination to advance health systems and sustainable development. There should be conversations around both communicable and non-communicable diseases. There was emphasis that non-communicable diseases seems to be forgotten or seems to be left at the backdrop. And there was a call that we should advance integrated health services where conversations not only focus on places where there's money like malaria, TB, HIV, and so on, but that we should not forget non-communicable diseases in our conversations. And finally, there was a need to educate our community, that we should educate our community through health education, citizens' rights, and so on, so that they know what they need, and we follow what will be their priorities, talking about client experience in this case. I will hand over to 𝗥𝗂𝗂 and can move on from there.
Okay, thank you very much. So I think we get to the wrap up. So quickly, I think we've talked about the experience that we've had this year with the reduction in funding cuts, and countries have responded: Ghana, Nigeria, Malawi, Kenya, and a few others. But it is also clear that a large number of countries within the continent have not responded. Now, they have not responded, they've not been able to demonstrate adaptive leadership. So it is really necessary for us to have a governance mechanism that will be put in place to address this challenge. And the governance mechanism must be inclusive. We also learned that, governance is a continuum, and we really need to make sure that people are really included in the process. From the African CDC perspective, we talked about the African health financing in the new era, and this includes important pillars of domestic financing, innovative financing mechanisms, among others. And then finally, we are at a stage where self-reliant healthcare, as was said, is not a choice. It is an imperative, and we all have to move in that direction. And in doing so, we really need to carry our communities along. So this has been the key highlights of today's session. I'll go on to acknowledge our sponsors: Africa CDC, African Health Catalyst Forum, Cutting Edge Public Health Solutions, AP Solutions, African Hub for Innovation and Development, PNP Ahead, Policy Innovation Center, 𝗔𝗯𝗲𝗃𝗍𝗍. We really, really want to thank you for bringing all this to us. Finally, to our panelists, it's been extremely exciting. I really want to thank Dr. Rouballo, Dr. Tajuddin, Dr. Matanje. It's been very, very, very interesting session that we've had today. Now to my co-moderator, Robert, thank you very much for your support. And I also thank myself for moderating this video. So over to you, Edward.
Yes, thank you so very much to all our panelists and Dr. Tajuddin, Dr. Rouballo, Dr. Matanje, and of course to our erudite moderators, Professor 𝗧𝗨 and Dr. Chigil. We sincerely appreciate you all for sharing your wisdom with the continent. We are glad. It's been a journey. We've reached the final roundtable of this series, and really it has been a journey. The Season the Moment series has been more than just about talk. It has always been, from the very first roundtable, about sparking action, about igniting a movement towards self-reliant healthcare on the continent. We've shared ideas, we've challenged old assumptions. We've actually dreamed big during the dialogues. Now, as we stand here now at this point, we will be looking to carry that energy forward. And thanks to the comment from Barinada, yes, we will not just seize this moment. We will build on the moment. We will seek to create lasting change and ensure that every person across our diverse, rich continent has access to the quality healthcare that they deserve. Now, this forum wouldn't have been possible without the dedication of our incredible partners. To the Africa CDC, ably led by Dr. 𝗏𝗏 𝗏𝗏𝗀𝗏, the team that we've worked with, core, ably led by Dr. 𝗏𝗏𝗏𝗏𝗏, who is the Acting Deputy Director General. We sincerely appreciate you. Dr. Elias, as far, are you also here? You can please wave to everyone. Cutting Edge Public Health Solutions, we sincerely appreciate you. That is my own team. 𝗥𝗲𝗀 Solutions, we have our team members. 𝗥𝗲𝗀𝗏𝗏𝗀𝗏, are you there? Can you also wave at the people? PNP ahead. We have Pat Sadat Ngachu, 𝗥𝗲𝗏𝗀𝗏𝗀𝗏𝗀𝗏, Mr. 𝗟𝗲𝗏 𝗧𝗏𝗏𝗀𝗏𝗀𝗏. You can please bring your camera on. The Africa Hub for Innovation and Development, AFSA, Abdulsalam, please come on board. And Policy Innovation Center, your commitment to this vision has really been unwavering. We thank you all. I also can't thank enough my co-conveners, the 5 of us. Your rock solid dedication has been inspiring all the way. Now, let me say before I let you all go, this is not the end. Yes, the final roundtable, but this is the beginning. Over the next few months, the Africa Health Catalyst Forum will be rolling out concrete initiatives to turn our discussions into reality. Please stay close on LinkedIn, on YouTube, on our website, and we would also periodically update you via email. We'll be announcing the date for our next series. Now, that next series, honestly, is one not to miss. That next series is what you see on the slide. It is from global expertise to local impact, harnessing the African health diaspora. Now, I'm sure you heard Dr. Tajuddin, Dr. Rubalo, everyone who has spoken, every one of our leaders who spoke today talked about tapping into the African health diaspora. And now it is multifaceted. It's not only in clinicals, it's not only in technical assistance, but how do we tap into this global expertise we have as a continent to achieve local impact right within our continent? Please stay tuned. Before then, though, we will be inviting you to thought-provoking fireside chats with more leaders on the continent, and you won't want to miss any of these ones. The journey continues, and together, for sure, we will make it happen. Thank you so very much, everyone. Till we come your way again with another roundtable, this is us saying thank you. Thank you, everyone.
Thank you all.
Thank you.
Thank you all.